Hello, everyone. Welcome. For those of you who don't know me, my name is Reina Jara, and I'm a project specialist at the RHAC. I'm connecting with you all from Lima, Peru. And today we're going to go over the 2024 Contraceptive Social Marketing and Social Business Report, or CSM Report. And as you can see, we have an expanded name, and we're going to go over that in a minute. But first, I want to provide some guidance for the people who want to use our AI translation app. You can either scan the QR code on the screen or use the link that I'm going to paste in the chat. Here it is. And we have instructions in English and Spanish. If there are any Spanish, si hay alguien que habla español, puede también comunicarse conmigo en español. And you can also use the app that was just is shared in Zoom. And also, I want to let you know that we're going to have a facilitated Q&A at the end of the session. So if you have your questions ready or you want to ask any questions, you feel free to share it in the chat, and you'll make sure to gather them for when the time comes. So without further ado, we're going to start with the first section of the webinar, and I want to introduce Sarah Webb, our Senior Technical Officer, who led and guided all this process that made this version of the report possible. Sarah provides technical leadership to the coalition's work in advocacy and diversification of financing, as well as menstrual health. And she has over 10 years of global sexual and reproductive health experience, particularly around the intersection of sexual reproductive health rights and market development. And over to you, Sarah, for the opening remarks.
Awesome. Thank you so much, Reina, and thank you everybody for joining us today. We are excited to share the 2024 Contraceptive Social Marketing and Social Business Report with all of you. I think as all of you on this line know, at the start of 2025, the US funding cuts, followed by funding cuts from other donors, sent a tremendous shockwave through the reproductive health and global health spaces. And with that drastic shift in the funding landscape for family planning, as well as for other reproductive health commodities, social marketing organizations and social businesses will play even more of a pivotal role in ensuring that women and girls can access reproductive health supplies. And while they have long created a pathway for affordable access to reproductive health, the loss of US funding from the global architecture for financing family planning commodities will require us to make some different shifts and adaptations to markets, to business models, and to the way that women and girls access life-saving commodities across low and middle income countries. And so with that backdrop in mind, and the really important role that social marketing organizations and social businesses continue to play, we want to position this conversation on the importance of having data visibility into those markets. In order to
I think we lost Sarah. Yeah, I think we lost Sarah. I'm not the only one that stopped hearing
No, she
her.
froze. Yeah.
Okay. Oh, I think something happened with her internet. Our apologies. I know our DC office sometimes has a shaky Wi-Fi, so we're gonna wait for her maybe 1 minute, and if not, I can just go on with the next section of the webinar. Let me try to contact her. Yeah, I think she had to drop. So in the interest of time, I'm going to continue with the next section, and when Sarah is available to join us, she can continue with the opening remarks, which are going to cover a couple of things that we wanted you to have in mind. This next section, let me see. Oh, okay, it's my turn. Is going to be presented by yours truly. So I'm going to start with this quick overview of the 2024 CSM report. I wanted to start with this image right here, that if you're part of the advisory group, And probably Sarah was the one that was going to mention the advisory group. The advisory group was a multi-sectoral group of people that supported the process of the creation of the report, or the not creation because it was already there, but we wanted to gather feedback from the community and wanted to improve the parts of the report that needed to be updated or improved. And these categories come from the feedback that we gathered starting at the GMM in 2023, and throughout the whole process we also kept gathering feedback, and these categories are the ones that cover these different parts of the report that we thought, or that jointly thought that needed some improving or some updating after the many years that the report has been operating. And next we have, so we're starting the changes from previous years, and I see Sarah is here. So I can hand it over to you, Sarah, to finish your opening remarks, because we probably needed to cover a couple of things that I am not that I was not able to cover. So I'm just gonna hand it over to you real quick to finish, and then I'm gonna continue where I left off.
Thank you so much, Reina, and thank you everyone for bearing with us. Our office Wi-Fi dropped right as I was kicking off. I will keep this brief so that I don't take up too much of your speaking time, Reina. But I was saying, against this backdrop of a large shift in the global financing architecture for family planning and reproductive health, it will be even more important than ever that we have data visibility into the role that social marketing organizations and social businesses play in creating access to reproductive health supplies in low and middle income countries. And so by having this greater visibility into the volumes that different organizations are selling products in, as well as the different business models and approaches that they are using, we can use that data to then build more resilient access to reproductive health supplies and to ensure that we're meeting the needs of women and girls. And so this year, and Reina will be going through these in more detail in a moment, there's a number of changes that we added to the contraceptive social marketing report, building on the rich history that the report has through DKT International's leadership for over 30 years, and then most recently, the leadership and support of RHSC and its members. And so as we did last year, we continue to guide the development and the changes in the report through an advisory group. Several of our advisory group members are on the line with us today. And this group served as a really important space for
I think it happened again, but Sarah mentioned the advisory group, which is perfect. Oh, you're here again.
Can you hear me?
Yes. Yes.
Okay. I don't know what is going on with our internet. I will wrap it up. We have an advisory group that played a pivotal role in helping us walk through the changes for this year's contraceptive social marketing report. Reina will go into those in more detail in a moment, but a special thank you to all of our partners from the advisory group in serving as thought partners and helping us to make sure that this report meets the needs of those in the reproductive health community. Back to you, Reina, and thank you for bearing with me through some technical problems.
No worries. And yeah, thank you everyone for your patience again. And thank you, Sarah, for these opening remarks. It was a difficult year for everyone, and it was something that we wanted to address. And the work that has been put into this report is really something that we appreciate highly. So I'm gonna continue where I left off, about the changes that we implemented this year. I just wanted to go over a couple of changes that we rolled out last year we tried to keep it status quo for the most, but we did implement some changes. The first one was to include the USAID CYP conversion factor as an additional impact metric. We also disaggregated some product categories to add to the granularity of the report. And we finally eliminated a 10,000 CYP threshold that was in place for organizations to participate in the report. But this year we have implemented some more bigger changes that were of course based on the discussions of with the advisory group. And the first one is the updated name and the expanded scope of the report. As you can see, the new name is including now social businesses, And what we wanted to do is to better reflect the social marketing, like the evolution of it and how the business models are now have different aspects of different types of other types of business models. And we have created a visual aid for this that I'm going to share later, so you can see how we envision this new expanded scope of the report. The second change is the updated impact metrics. And the first one was that we finally removed the old or the historical CYP factor for the PDF version of the report, which includes the sales for the year and also the historical file, so we can just have consistency and comparability over time. So we just now have one impact or a CYP factor, which is the USA, and we're just going to call it CYP factor. The second updated impact metric is that we included an impact metric for uterine evacuations that cover some products, which are misoprostol tablets, mifepristone, the combi pack, the MBA kits, and the elements that include in the MBA kits. And we wanted to change this impact metric for these products from CYPs because we wanted to more accurately reflect the impact of these products within the report. And the third change that we implemented this year was to include the MPA subcutaneous, additionally to the 3 injectables that we had that were intramuscular. Because we wanted to enhance the product granularity, but also improve the visibility of this specific product that has been available in specific countries with the great work that allies that have been doing on product introduction. And so we wanted to include this category too. So I want to show you now the visual that I previously mentioned that, as you can see, it starts in the public sector. We wanted to show the total market, starting with the public sector that focuses on providing free products for the people that need it. And then starting with the private sector, we have these categories that cover like different brackets of users' purchasing power, starting in social marketing organizations that cover the need of people that have some purchasing power but need still some help in getting to the products, and then covering and rely some of their operations in subsidy. And then going to social businesses that are focused more on the sustainability of the business and are aimed at users that have a bit more of a purchasing power. And we finally have the profit maximizing, let's call it, companies that are aimed at the user that has the most purchasing power and that create access to like new technologies and work it with innovation. But what we wanted to show with this is that this is a spectrum that the organizations don't have to identify within a specific category or a bucket, but they can take elements from one type of business and the other and can lay in the middle ground of this spectrum. So organizations that may see that their business is going more in the way of social businesses, that they can also participate in the report and show the impact that all their operations and their work is having in the community. So this is the visual aid that we prepared for this. And we also, okay, so I wanted to go over real quick on the data that we received this year and how our map of the coverage of the report looks like. Compared to 2023, we have the same number of reporting organizations. However, this doesn't mean that they were the same organizations that reported. Some organizations, unfortunately, weren't able to report this year, but some other organizations incorporated data for the report. And this translates in the number of programs represented, which are the operations of these organizations have in the different countries. So as you can see, from last year to this year, we have more programs represented that also cover even more countries. So this is how our map looks for this year. And we hope that we can continue to add more programs and represent more countries in the report. Okay, that was all my side. I want to hand it over to Alexis to help us view one of the other changes that we implemented this year, which is the historical file. I'm going to allow you to share your screen, but I want to present Alexis very quick. Alexis is our senior manager for data and process improvement, and she has nearly 20 years of experience in supply chain management, market dynamics, and data analysis for public health. Her work focuses on using data-driven approaches to strengthen health systems, conduct market analysis, and improve pharmaceutical procurement and distribution. Over to you, Alexis. Do you want me to stop sharing my screen?
Yes, can you see mine now?
Yeah, we can see your screen.
Okay, perfect. And it's the Excel file. So great. Thank you, everyone. Thank you, Reina. I wanted to also just put into the link in the chat where you can actually download the historical data file. In addition to the PDF, I think it's been a really exciting opportunity and resource over the past years to have this historical data file. So as much as many of us enjoy just reading the report, some people want to go deeper into the data. So, and it's a very impressive data set that goes back to 1991. We've made some changes this year just to make it a little more accessible in terms of how to use the data. So through that link, you'll be able to see where the data is able to be downloaded. As you download it, you should be able to open this file. We've included a few notes in this first tab here around changes that have been made this year, what is in this file, what it represents, and envision continuing to update this in terms of changes that are made. And then there are multiple tabs here that you can click on that, as I said, go back in time as far as 1991 by organization and currently shown by product to see sales by year for each country program combination for which we have data. And so obviously, if it's a program that has only started reporting recently, there is not all of this historical data. Similarly, for programs that had reported, historically and don't have data now, those rows will be blank, but it is the full and complete data set for all of the information and data that we have by year. Similarly, there's a table here that's been created showing the same view with the CYPs by year. So you can look over time to see what those changes have been over time. For those of you who may want to look at different subsets of data or in different ways or select different countries, the pivot table file is available here if you want to select a subset of countries to look at. If you want to look at it instead of by product, you can select methods, so sort of rolled up to the higher method level as opposed to the product level detail, CYPs. This should provide a flexible format that allows users to, review the data. And then for anyone who wants to see the raw data set, it is right here organized in such a way that enables the pivot tables and is there for users to access in different ways. This is part of a process for overall data improvement. We are also looking for additional ways to make this data set available and flexible for users to do their own types of analysis depending on what you might be interested in, to look at it in different ways. But hopefully this is a slightly more flexible format as we continue that journey to try and see how we can make it useful. And I think through this process, as people who are interested and on this call, if you have feedback on what would other views that would be useful or ways that would make this data more useful to you or more accessible, we welcome that feedback, and I'd love to hear it as your ideas as we think about already how we might improve this moving forward. So that's it for the data file overview. I'm going to stop sharing my screen. I think there was one view just to sort of, as you think about how to look at this data in different ways as we were thinking about how to analyze it. I think it's important to, and Raina, I think this is the next slide that's on the presentation, if you're able to share again. Just keeping in mind that as we want to look at historical trends and do analysis over time with the variations across the number of programs each year, it's a little bit hard to come up with ways that make this data comparable, given that there are good reasons why sales data may fluctuate over time, given the changes in the number and types of programs and organizations reporting. But I think looking at proportional trends over time is one good way to look at this. And we thought this was an interesting view to sort of understand proportionally for methods that accounted for over 1% of sales each year, how we start looking at trends across methods by CYP over time. So this is one view that we came up with, but I think there are, with this data set, keeping in mind some of the proportionality needs to start looking at different trends. So thank you.
Thank you so much, Alexis, for this comprehensive view of the new historical file. And of course, if you have any questions on the use of the file, you can always contact us. We're going to send you an email address where you can ask your questions about the historical file and the report itself. And now I'm going to introduce our panel. And the panel is comprised of people from the advisory group. And as Sarah mentioned previously, the advisory group was key for the development of the report. And we are we are grateful for their hard work during all these months, the work that started in early 2024 until this day. So I'm going to introduce each of them real quick. First, we have Abby Wimsko. Abby leads the Delivering Innovation in Self-Care program at PSI, successfully bending the curve on adoption of self-injection contraceptive across 8 countries. She's also the co-chair for the Market Development Approaches Working Group of RJC, and we really appreciate her work with us. We also have Chris Jones, an independent consultant with over 25-year work journey that began as a social marketer in Asia and Africa. Chris now partners with donors, governments, and implementing partners to figure out how new and long-standing health technologies can bring the greatest impact to the most people. And last but not least, we have Jason Bremner, who is the Senior Director of Data Evidence and Measurement at FP 2030. He has spent the last decade working to expand the availability and use of family planning data for decision-making, leading the annual publication of the FP 2030 Measurement Report and working with FP 2030 partners to advance measurement of sexual and reproductive health. Welcome, the 3 of you, and I'm going to jump real quick to the questions, but I want to stop sharing my screen so we can all see each other. And I think I can spotlight. I can also spotlight Abby and Jason. Okay. So I'm going to start very quick with the questions. So the first one is, drawing upon your experience and perspective, how does the use of the CSM report contribute to informed decision-making? And what do you find most unique or most valuable about the data of the CSM report? And I'm going to hand it over to Chris first.
Thanks, Raina. And thanks, Sarah. And thanks to RHSC for taking on this work of consolidating this data as a public good. And thanks to DKT for long producing the report. I'm not sure exactly the backstory of how this started, but as a user of the data, I'm very much grateful for it. So for those of us that have supported analysis to understand how well a market is functioning to address the health needs of the population, as well as the opportunities to improve access, affordability, and use of important products, the data is really hard to get. Anybody working in public health knows this. Public sector data can be limited to what is procured, and even that can be spotty. We're not really privy to what is distributed or reaching the end user. And the good data for commercial sector is either not available or expensive through agencies like Euromonitor or IQVIA. So I usually go to the social marketing stats report as a first step to understand market size and potential. I'm not paid to say that. It's really helpful because it's consistent and therefore comparable across years, providing important trend data. It's standardized year to year, but it also allows benchmarking across countries. It's reliable in that it captures most of the social marketing work that's out there, and it's super easy to access. So all of those things make it a very unique and rare data set to access. So that's important if we're looking either at global trends, but also very much for country-specific work. And what I found, it's especially important in understanding both the current and the potential situation of what's going on in the private sector. And even though we're talking about social marketing, specifically given the importance that social marketing has played in delivering healthcare products and services through the private sector, it's a really important data piece to, first of all, understand, what that body is doing, but also begins to help us understand what else is going on in the commercial sector as well. So those elements combined make it extremely helpful through a known number with the social marketers, but also beginning to triangulate and get a better informed picture of what's going on with the rest of the market. So that's my experience.
Thank you so much, Chris. And yeah, definitely all the things that your experience is probably the same experience that other users have with the data of the report. And to continue with this question, I want to hand it over to Jason. I think he also has some insights on this question.
Thanks, Reina, and thanks also to RHSC for taking on the next generation of this important report, and of course, a thanks to DKT, who has done this for so many years and was also willing to and recognize the importance of it, but recognized that there were improvements that could be made, and it was better to hand it to a different organization to do that. So I just want to say kudos to Chris Purdy, who I believe is here, for that vision. Since 2012, I've worked with FP 2030, FP 2020 back then, to expand access to family planning data for tracking progress, understanding trends, using data for country, regional, and global decision-making. And it's a huge exercise to manage data like this. We report on 25 common indicators across more than 80 low and low middle income countries. And data like this, captured over time, provides a great deal of information on contraceptive use, on method trends, and on the public-private market and the mix amongst those, where people receive their services, amongst other things. These data that we put together in the annual measurement report, however, aren't perfect. And the deeper that we dive into data, the more that we identify gaps, and we start to see problems or things that we're, I think Sarah talked about visibility, where we lack visibility into certain methods or certain aspects of the market. The Contraceptive Social Marketing Statistics Report has given us additional visibility in a critical segment of the private sector that's been discussed today. And through that report, we're able to see some of these problems and identify some of these gaps and get insights. And I'll give just one quick example of where I have used this actively with country decision makers and with my team. We were hearing anecdotal reports in many countries of large increases in the use of emergency contraception. But the traditional data sources that FP 2030 uses to report on contraceptive method mix were really not showing any increases in the use of emergency contraception. Now, remember, people are asked, well, women of reproductive age are asked, are you currently doing anything to prevent a pregnancy? And emergency contraception is a response option, but what does it really mean to be currently using emergency contraception if you used it at sometime in the last 12 months or sometime at last sex? So we said, well, okay, we're hearing this anecdotal evidence, but what do we have to show trends? And we turned to the data from the CSM report. I had a conversation with Chris Purdy about this, and said, the volumes of EC distribution are there. You can go in and look at it by country, by partner. And it illustrated a consistent growth in the volume of EC. And I'm glad that Alexis showed that the data with the distribution of methods, because I actually could see it there, that small little green segment growing from something like 0.4% of the market share in 2015 to something like 3% now in the graphic you just showed. So we were able to look at that, and actually it's resulted in a change in the way that some of these questions are being asked now in large-scale surveys. So yes, we still ask, are you currently using EC? But somewhere else in the questionnaire, we ask, have you used emergency contraception in the last 12 months? And now we started to see, and we can see, where that EC use is growing. So it's a really critical resource. That's one way that we have used it. And it's also, it's advancing measurement in the field, in addition to giving us those trends on a particular method and a particular segment of the population that may be using that method. So thanks for that question.
Yeah, thank you for the answer and for those examples. Are definitely just one of the many uses that the report has, and it's this aggregates data for so many years, and it's definitely a very valuable resource. Thank you, Chris and Jason. We're going to move on to the second question. This question goes as, following the work conducted to reach the present iteration of the report and having considered the diverse perspectives, what do you find to be the most valuable aspect of the expanded scope of the report of this year? And I want to hand it over to Abby to reply to this question.
Great, thank you. Well, first of all, many of you heard in my introduction that I oversee the DISC project, which is focused on bringing in self-injectable contraceptive, or DMPA-SC. So I do have to say, from a personal perspective, I'm very excited to see DMPA-SC split out. And as many people who work in that space know, there is going to be a generic coming, and that there's going to be more investment in private sector, and some social businesses and social marketing organizations hopefully will have the opportunity to expand distribution of that product. So it's one that's close to my heart in terms of seeing that come in disaggregated into the report. But aside from that, I think one thing that I'm excited about, and we had a lot of conversations was about making this clearer distinction between social marketing organizations and social businesses, because there has been a large shift and evolution over the last 10 years as subsidy for all of these commodities has pretty much come down to nothing. For example, PSI, as well known as a social marketing organization, selling products, subsidized products through funding from a variety of different donors over the 40 years. But the reality is that all of that subsidy has really gone away. And now PSI has actually created a separate social business that is totally separate and totally financially independent and sustainable. And so we really wanted to make sure in this report that we made that distinction between social businesses and social marketing, just to provide a more nuanced view of the market. And not to say that one is better than the other, but it's just useful to understand, because I think there's still this perception that brands that are known to be historically socially marketed are still subsidized, but that's really not true. But I myself have seen reports or articles where they say the author says, oh, this market is still highly subsidized. yes, those brands used to be subsidized because they were social marketing brands, but that doesn't mean they're still subsidized today. So just trying to provide a little bit more of a nuanced view of the market. Now, I will say it's not always easy to capture in this report, that level of subsidy, whether it's a social business or a social marketing organization. So I think we'd all agree that it's not it's not a full picture of that, and that is hard to do. But I do think this making, at least even the way that the report has been named, recognizes that there are different types of groups that are active in the market, and that as organizations and ministries of health and donors and funders are looking at the report, they're able to maybe pull apart or at least ask some questions about what level of subsidy really is in the market. So I'm excited that this at least can help start a conversation around that. Thanks, Rena.
Thank you, Abby. And just to add a bit to what Abby mentioned, this year we also started providing organizations with the option to report on subsidy and a specific product. So this is still an optional reporting. Organizations can opt out, of course, without affecting their participation. But we have received some data from that, and that is definitely something that we look forward in upcoming versions of the report or years of the report. Thank you so much, Abby, for your insights. And I am going to move on to the third question, which is, at such challenging time that we all know, what is the most important aspect for you of working collaboratively and multi-sectorally to achieve common ground for a tool that is aimed at supporting the reproductive health community? And I'm going to hand it over to Jason for this question.
Thanks. I think challenging time is an understatement. And I think, it's an unprecedented time. I think challenging time, I think back to the COVID pandemic and the resilience that the field showed, and what we needed to do in the data space to understand disruptions to services, the impact on people and their access to contraception, and the quick responses that were made by social marketing organizations in some cases to fill gaps as public sector facilities had some troubles reopening as quickly and nimbly as the private sector. That was a challenge. Now we're in an unprecedented time. I'll say this because on the data front, we have, of course, lost thousands of people from our sector. We have lost millions, hundreds of millions of dollars in funding. And we are losing frontline healthcare workers due to closure of projects and unfortunately the termination of projects and the incredible results that those projects were able to achieve. We're also losing the data systems and the loss of the demographic health survey, which is a critical resource for sort of benchmarking yourself periodically on trends, as well as the undermining of logistics management information systems and health management information systems. It really is very distinct from like a large-scale disruption like COVID, because not only are we feeling the disruption and the incredible tumult of that, we're also losing visibility into we're losing visibility into the impacts of all of these changes. And we, FP 2030, who are putting out our measurement report this year, we're looking back in time. So our measurement report this year is really looking at data that was collected in 2024 through surveys, HMIS systems that closed in 2024. We're not yet even looking at the 2025 data. And when the time comes to look at that 2025 data and see the impact of this terrible moment on services, on outcomes, what will we have to draw upon? We won't have surveys in the next several years in most countries. And so we are going to have to use everything at our fingertips to understand changes. And I think the CSM report, which has been with us for so long, is probably an undervalued resource for doing that. I can tell you right now that we are working with individual social marketing organizations to look at trends in their monthly service volumes. And I can just imagine, that would be a huge task to do across many countries, across many partners. But here it is, the CSM report that already is going to have that data by country, by method. And we are going to use this far more, I think, in the next year or two than we have in the past. So for us, it's a critical moment. It's a critical resource. It always has been, but I think even more so at this moment. So I urge all those who contribute to this to stick with it. And I can promise that we'll be using it quite a bit at this critical moment. Thanks.
Thank you so much, Jason. And yes, definitely these times are affecting each and every one of us. And these resources are going to continue to be working for the community, and we're hoping that they're going to continue to improve. I'm going to hand it over to Abby to reply to this question too.
Thanks. Yeah, I would just very much build on Jason, on your points. I think as we think about what tools are going to help us in this time, I think we have to think about the increasing need to support ministries of health as they make decisions with less funding for commodities and reproductive health commodities. Ministries of health will be making decisions about where to put their more limited investments, and data is key to support that. We're also seeing that there's a desire and a hope that the private sector will play a bigger role in providing reproductive health products and services, but that requires those commercial actors or private sector partners to have enough data to see the opportunity there. So I think really making sure that as we think about these key decision makers to from a sustainability perspective for the commodities market, we need to make sure that these tools are going to be useful and able to be used by these critical players. So I think that's one area. And then I would just say also, I think that the field, we've lost people, as Jason said, we've lost data, we've lost information, but there is still a lot out there, and we really need to make sure that to the greatest extent possible that we can triangulate across different data sources as much as possible and make those connections. And I think that's a role that RHSC has played and is continuing to play and has a strong vision for how to support that. The Commodity Social Marketing Report does provide that snapshot, particularly where we have a blind spot on private sector data, and that's really valuable. It's also only one piece of the market, and so really thinking about how we could triangulate that with other data from LEAP, from other sources, to think about trying to paint an while imperfect as clear a picture as possible. So I think those would be my two areas. One is not to look at these in isolation, but to think about how we bring those data sources together. And secondly, is to make sure we're really clear on who the decision makers are in this new world, and what support and how these tools can be most useful to them.
Thank you so much, Abby. Yeah, you mentioned a couple of the resources that the RHAC has available of data for the community, and we're definitely going to continue to showcase them and try to be more collaborative each year. And I want to hand it over to Chris. I think you also want to provide some insights on this question, Chris.
Well, just real briefly, I'll echo Abby's comments both earlier and just now, in that recognizing the evolution of social marketing, which is becoming much more sustainable, less reliant on external donor funding, which is going to be critical as health systems move forward and shift from this the absence of donor funding and become acclimatized to this new reality. Understanding what's going on in the private sector and the ability of populations to be able to pay either out of pocket or through third-party financing like insurance is super important. and using this as an advocacy tool to help governments understand the existing role of the private sector in social marketing, and also what potentially is possible. And looking at that as an integrated approach to meeting the holistic needs of populations is super important. And so, again, having this data and using it actively to help governments rebalance markets and reorient in a more sustainable way is an unfortunate opportunity that we're currently faced with.
Thank you so much, Chris. Thank you so much to all of you for your valuable insights. And of course, you're representing a whole group that included many people that have different perspectives, and we really appreciate all of you. And I'm going to finalize the panel with a final question for each of you. That is, what is a call to action that you may have for RHAC members or partners that are listening today? And we can start with Jason.
Thanks. I think the call to action here, from my perspective, is curiosity. And I think it's hard when you're one of these producers of data. You produce, I think I said recently, mountains of data that underlie, one graphic, the graphic that Alexis showed on trends, on method. That is built from the bottom up, country by country, method by method. It's actually product by product in many cases. And so you may see one graphic, and I think someone, Tina here, asked about trends in emergency contraceptive use, but there's so much more that underlies that. And look beyond that one graphic, look deeper into the data. I think, as Chris and Abby have mentioned, there is a lot of work that needs to be done to help countries determine how to use, how to prioritize with their limited funding, and also how to finance their programs and the commodities. And it's going to require a deep understanding of the data. It's going to require analysis, and it's going to require getting into the data sets at times. So curiosity, look deep into that data. Hard choices need to be made, and they need to be made on real information and real data. And it's there, but it requires time. Something that I think the Instagram world doesn't seem to have. And so I encourage you all to dive deeply and encourage your kids to do it too. They'll be our replacement in 10 years.
Exactly. Thank you so much, Jason. Abby, what will be your call to action for today?
Yeah, mine is very similar. In fact, it might be saying the same thing, but a slightly different wording. But I would say I used to work for a company before PSI, and one of our mottos was, we don't know what we know. And I think sometimes that's true of the sector, that while we know there's a big data gap, we also, not all of us know what the sector knows. And so I would say just spend time with the tools, spend time with the Commodity Social Marketing Report and what Alexa shared, and like diving deeper into the data and the other data sources that RHSC is sharing, and share your data. Let's help the sector know what we know, and I think that's going to be really important.
Thank you so much, Abby. Yes, that is also our call to action at the RHAC. Share your data and review our data tools. Finally, Chris, to finish the panel, what is your to action?
A word of wisdom. I think out of this really unfortunate situation, out of chaos, comes the opportunity to rethink how we're supporting the development of sustainable health impact. A lot of these things we've been talking about for a long time: a total market approach, a market development approach, systems approaches. But now's the time to really help, I think, apply our minds to really consider, like, how can we reorient and reshift healthcare in these priority countries that we're working in.
Thank you so much, Chris. Well, this is the end of our panel. However, we do have some minutes for a facilitated Q&A. And so if you have any questions for either our panel, for Sarah, for Alexis, or for myself, you can drop it in the chat. And I'm going to hand it over to Sarah because she's going to facilitate the Q&A and also provide some closing remarks for us today. So Sarah, I'm going to add a spotlight for you.
Thanks, Rena. Hoping that internet cooperates for this attempt at our closing remarks and our Q&A. So as Rena said, we have a couple of minutes open for Q&A. So if people have any questions, please feel free to drop them in the chat. I will just highlight the one question. Tina had put a question in the chat that Jason has responded to, but just kind of calling attention to that for those of you who haven't seen it. Tina had asked if the analysis of EC use trends that Jason had spoke to would be published, noting that that would be very valuable for the community. And so Jason confirmed that FP 2030 has done some past analyses. Those are published, they're publicly available, but that those analyses don't include the updated data that just came out with this 2024 CSM report yet. And so if you want to dig into those trends, and really take Jason up on his call to action and get into the data, if you download the data file that is on the website page, you can dig into that file that Alexis was walking through. And so using that file, you can sort to emergency contraception, you can look at trends over time, you can filter to specific geographies, and kind of use that to build your own analysis or your own kind of areas that you're interested in diving into. Alexis, I don't know if you would add anything to that. You did a lot of the data cleaning and the work in making that file what it is today. So I'll see if you have anything to add and how to pull trends over time.
Yeah, no, I think you covered it well, but if there are specific questions or things, anyone wants to, I'm happy to walk through it with anyone and sort of show how you might find those different views. Please reach out and let me know.
Thanks, Alexis. Any other questions that people have? Raina put a link to that historical file in the chat. Other questions, reflections? We're a small group, so also happy to have people come off mute if there's anything else that people want to ask. All right, I'll move into our closing remarks. I will keep an eye on the chat in case other questions come up. And then Raina did just drop in our CSM report email in the chat. So if people have additional questions, comments, reflections as they dig into the report in more detail, feel free to send feedback there. And that tees up really nicely what I wanted to say in closing, which is that a big part of the changes that we made this year in partnership with our advisory group was really to try to better meet the needs of the reproductive health community. And that includes all of you. And so as you're digging into the report, as you're looking at the data, if you have moments where you're like, oh, I wish that I could compare this to this, or I wish that through this report, I could gain visibility into this type of situation, please do reach out and share those with us. As Raina has said, and as our advisory group members on the call with us today have said, we really do want to continue to build on the excellent foundation of this report that the DKT International established and created over the course of 30 years. And to do that, we want to hear from you and make sure that what we're doing, what we're changing, and how we're adapting the report really does meet the needs of people who are using it. So do continue to reach out. We have a couple of additional changes in mind that we'll start to implement over the course of the next year. And then the second thing that I wanted to speak to is kind of the role that RHSD is hoping to play in bringing some of these different data pieces together. And so as Abby said in some of her remarks on the panel, this is a subset of a much bigger picture of reproductive health supplies access. And it gives really great detailed insights into the social marketing organizations and the social businesses. But those two business models are part of a much larger ecosystem, as Raina was walking through in that visual earlier in the presentation. And so one thing that we're hoping to do kind of in the years ahead is bring those pieces of data together. So to tell that story in a more meaningful way, what are we seeing in public sector? What are we seeing from social marketing organizations? How do those pieces kind of fit together? And what does that mean for access? And what does that mean for where there are gaps in access? And so that's something that we are working on. Alexis, I don't know if you want to add any further thoughts to how we're thinking about next steps there. But I'll give you a moment to do that if you would like.
Sure. We're trying to build out something that is much more of a flexible data platform that allows multi-user access, public access, that brings some of our existing data resources together in a way that allows them to be compared and combined in new ways. And so this is a work in progress, but excited to share this as it becomes more of a reality in the coming months with all of you and others, and sort of to get input on this. But that is the idea, is knowing that the coalition does produce many valuable resources that include data around reproductive health supplies. And we're, acknowledge the fact that sometimes currently they're disparate and hard to access together. And we're working on that. And then ideally beyond, once we've cleaned our own house that way, we will start looking to include other data sets and how we can better serve the data needs of the community.
Thank you so much, Alexis. And then the final thing that we'll say is kind of to build on what Jason and Tina are talking about in the chat. If there are other perspectives on different analyses that people are interested in, definitely let us know. Part of what we want to do is ensure that this report has both the data, but also some of the analysis and some of that story behind the data as well. So please do continue to reach out. I want to extend a special thank you to Raina and Alexis for all of their hard work in developing this year's report, to all of our advisory group members who have given us countless hours of their time in coming up with some of these changes, these new metrics and new analyses, and then to each of you for joining today. Your participation in this is what makes this report possible, and we really appreciate all of you, as well as all of the organizations that shared data with us. So thank you for joining our 2024 CSM Report webinar. Do reach out with any remaining questions, and have a great rest of the day. Thanks, everybody.